We all want a healthcare system that helps our families live longer and healthier lives. My name is Jordan Engvers. I'm a data scientist and the co-founder and CEO of Cohesic. At Cohesic, we focus on cardiovascular diagnostic imaging because millions of people around the world suffer from heart disease. It is a complex and chronic illness, and treatment is plagued by missed prevention opportunities, inefficient service delivery, and unnecessary testing. All of these result in poor patient outcomes and economic damage. As a community, we can do better. To address these shortcomings, it's important to understand why they exist. Medical software today is designed to capture data related to the administration of healthcare, but doesn't provide a cohesive picture of the patient's health. Even when the data do exist, they aren't available at the time of decision-making, when the clinicians need it most. This means that talented clinicians have to provide care while relying on small, disparate pieces of data. So, we created CardioDI, a platform custom-built to empower clinicians with the right data and the right tools in the right context to improve clinical decisions. This is decision intelligence. We understand that there are always companies with new platforms asking you to change how you work. That's why at Cohesic, we worked with cardiologists and radiologists to design and create an elegant platform that can integrate seamlessly into your workflow. We want to be sure that we're helping you do your job, not putting another roadblock in your way. We're going to give you a peek at CardioDI, our main platform, and also Intake, our patient-facing software that captures self-reported health data and puts it directly into practitioners' hands. Let's look at Intake. When a patient walks in the door, the first thing we have to do is collect data relevant to their cardiovascular health and get their informed consent for data use. Most clinics are still doing this with pen and paper. The patient fills out the forms, and it's filed away or manually entered into a computer system, hopefully with no errors. But are those data there when a physician needs to make a decision? With Intake, the patient enters their information on a tablet and their data are readily available to the clinicians in the diagnostic imaging service. The rest of the process, from the referral to sending out a final diagnostic imaging report, lives here in our main platform, CardioDI. CardioDI is an end-to-end workflow and reporting platform that evolves your cardiovascular diagnostic imaging service into a value-generating system for capturing data, supporting diagnostic decisions, and creating high-quality and actionable imaging reports. CardioDI uses intelligent tools to eliminate the need for typing and dictation, and to create a cohesive workflow where everything is in the same place. CardioDI can integrate with your electronic health record system and other enterprise health IT systems you already use. Now, before a patient comes in, a referral is sent to the clinic. CardioDI users can select the clinical indication using a list specific to that modality. This indication is linked to the appropriate protocol, ensuring that the imaging plan is appropriate to address the clinical question. When the scan is being performed, this protocol is available to the technologist so that they know what has been planned for this patient. Data can be easily imported from your image processing software. The interpreting physician can then automatically compare these measurements to configured reference ranges adjusted for the patient age, sex, and body surface area. CardioDI displays the appropriate clinical findings and generates natural language. Again, no need for typing and dictation. The interpreting physician can then use our structured reporting interface to add other clinical findings, and language is generated based on these new data points. Let's look at a more sophisticated example. Graphical scoring is a much better tool for describing fibrosis patterns than dictated text. As the interpreting physician uses the graphical model to indicate the distribution of ischemic injury in the left ventricle, CardioDI translates these graphical scores into structured findings and generates natural language describing the fibrosis. All of this results in a standardized, data-driven imaging report that can be sent out automatically to other hospital systems, such as the EHR, improving communication to the referring physician. Last example. Let's look at how this applies to CT coronary angiography. CardioDI has a coronary artery reporting tool called CARET. With CARET, a clinician can create a patient-specific diagram of the coronary anatomy. They can indicate the presence and extent of disease, and even record prior interventions. When they have completed the diagram, CardioDI turns their findings into structured data and natural language. Using dictation or typing, we would get a report that is unstructured, highly variable, and error-prone. Instead, with CardioDI, we have a rich report that is data-driven, consistent, and a delight to read. By using domain and modality-specific tools, you can dramatically increase the value and utility of the diagnostic imaging report. With the right intelligence infrastructure, it is possible to generate research-grade data for every clinical case while improving operational efficiency. High-quality data fuels the development of decision intelligence tools that could answer patient-specific questions, such as what is my patient's risk of developing new-onset atrial fibrillation, or having an early heart failure admission. When these tools are delivered at the point of decision, care can be tailored to the individual patient, ensuring resources are used effectively and optimal outcomes are achieved. Buckminster Fuller once said, "If you want to teach people a new way of thinking, don't bother trying to teach them. Instead, give them a tool, the use of which will lead to new ways of thinking." We all want better care, delivered effectively and efficiently. In order to do that, our physicians need the right tools for the job. And at Cohesic, it's our mission to create those tools. If you want to see a full demonstration, click the button at the end of this video.